I genuinely believe that people try to offer the best services that they possibly can, but I don't think that we can always appreciate how inadvertently some of our actions or behaviours might be impacting on someone who's been through quite a lot of distress within their life. And, you know, taking a trauma-informed approach ensures that we recognise this, we understand it, and by taking sometimes very, very small steps in terms of where we provide our services, how we provide our services, even when we provide our services, can make all the difference to someone's trauma being reduced rather than exacerbated by the efforts that we're trying to make for them.
I think, you know, if you think about somebody who has a physical disability and how able they are to access something as simple as a doctor's appointment, and how horrified we would all be if that person isn't able to access a service like that because they're physically unable to get there, and all the help and support that would be given to that individual to manage to get to a GP appointment. Quite rightly, we would be horrified if we discovered that there were barriers put in that person's way. And that should be the same for somebody who's suffering trauma, or is suffering the effects of trauma that they've endured in their past. I think it's part of our human rights, isn't it, to be able to access the help, care and support and be a fully engaged member of society. And we should be ensuring that we're providing those opportunities for people. You know, it's we don't want to exclude anybody from accessing something as simple as a GP appointment. For somebody who's suffering from trauma, something like that can be as debilitating as a physical illness.
I think for me, it's really important that we don't see this as a single issue item and really join this up with our real intent to tackle inequalities and health outcomes that we see across our system. And I really believe that trauma-informed responses is a key enabler really for how we tackle health inequalities, because if we deliver care in a way that helps people who have experienced complex trauma, if it helps them engage and connect better with support, then that's going to lead to better outcomes for them, which is what we're all about really.
We've had such a difficult time in the public sector over a number of years with budget cuts. The focus has largely been on efficiency and trying to do things for the best value that we can, which is of course important. But I think sometimes that has been to the detriment of our own compassion and humanity and allowing those values to flourish within the systems that we work. So for me, the trauma-informed nature of the work that we do and the practice that we can provide really gives us a framework to apply that humanity and that compassion to the work that we do every day.
Only really that I think we've realised as we have been developing our trauma-informed practice, we've realised that it's so much more than simply attending a training course, and the need to embed it across our whole organisation, in our recruitment, in our management, in our policies, in our ways of working is now absolutely the priority.
But I think leadership at all levels is really crucial for embedding trauma-informed responses and how we do things across the system. I'm chair of Aberdeen IJB and I'm also a trauma champion. And so I'm quite relentless in how I raise this topic and I ask questions about it. I'm always curious as to how trauma is being considered in every service redesign and system change which is put before us as an IJB. And I know, because I've asked the leadership team about this, I know that it has helped the leadership team embed trauma-informed thinking in their planning of services and redesigns, and it helps keep trauma as a really visible priority for the partnership.
It's really clear that leadership is essential. We talk about parallel processes. We know it has to happen at grassroots level and at leadership level. But I think the evidence over recent years really shows us that no matter how much we do at grassroots level, the leadership is crucial. And for me, it comes down to this idea that it's never me over here in my comfortable leadership role and you over there with your family and your mess and your trauma. It's got to be us together in the middle, working together. And those relationships at the heart of everything have to be at leadership level as well. So if we want people to trust our systems, if we want people to trust our schools, our NHS, our social work supports, we have to be there as people, as leaders, as people. We have to be authentic. And that's the only way that we will get people to trust us and to trust the systems.
I mean, leadership is about leading by example, and we need to demonstrate as leaders how important this is to us and why we think our staff need to support this approach. And we need to make sure we have consistency in approach right across all of our services, because we know that dealing with families with trauma, it's not just one service they rely on. They rely on a number of services that we offer, and we need to make sure that we have that consistent approach right across all of our services, and we join them up in the most sympathetic and supportive way as we possibly can.
As leadership are the ones who get to set what an organisation deems as valuable and what it makes space for. Leadership is responsible for prioritising the time, money and resources for things that they see as important. And if they not only say but show that they think trauma-informed practice is the way forward, then they will ensure staff are properly trained, supported and encouraged to work in this way. There will be accessible leaders who will work with their team on areas where tension arises between people and processes, and they will commit to listening and learning. They will make time for the well-being of people, and they will set the tone of how people interact with each other, both internally and externally.
And leadership's also about influencing and nurturing, both internally but also externally, to bring about that systems change that we know is needed to tackle some of the entrenched inequalities across Scotland. And one of the best ways of bringing about that change, and that significant change, is really to model that change in our own behaviour and our own work practices.
So for me, I learned many years ago the fact that the answer to every question, no matter what that question is relationships. And my opinion is that the identification of the importance of a direct focus on the factors which, if correctly addressed, will create sustainable change, behavioural change that's positive and impacting families, individuals and the broader community. That needs to come as a consequence of the relationship between leadership and those who deliver our service. So if the leaders are speaking the correct language, understanding exactly what we need to do to make those step changes and make improvements, then those who are able to make the change will have the proper direction, tools and ability to do so.
I probably say the same thing all the time. I often get quite frustrated when I hear lots of people talk about being trauma-informed or delivering trauma-informed services without really looking at what that means in practice. And certainly within my own area, I have asked people to look at the trauma-informed principles and break it down so that we know that we are achieving what we're meant to be achieving, and not just to say we're trauma-informed without actually thinking what it means in practice.
So what leadership provides for trauma-informed services is multifaceted, and it's not an easy question to be able to choose just one. So it should be inspirational, it should validate the concepts, it should permit the change that's required, but also communicate those changes. It should also be functional, and that it endorses the changes that have been identified that can be in really complex systems, and then help to sort of navigate troubled waters when sometimes there is resistance or stress experienced in the system. But ultimately it aims to embed the concept and make it real for the workforce. And then thirdly, I think leadership should be operational. It should be enabling and create capacity in the system to be able to absorb the change. It should also be able to allocate resources where required and then monitor the benefits of those changes.
So we need to make people accountable for the things that we think are important, and that can only happen if the leadership is willing to change those, take responsibility for changing those processes. So that's why it's important, but also over and above that, it's important that workforces get the necessary training and tools to be able to confidently deliver and unlock the potential that people have to be able to grow and develop. So it's very important leadership. It needs to be an open leadership. It needs to be a facilitative leadership. It needs to be a leadership that leads from the front. And you know, we need courageous leaders. We need leaders that say this is not working, and we need to work better.
So I think for me, in terms of leadership, it's really about leading by example. And I think we've all got vulnerabilities. We know our customers, we know our clients, we know our colleagues have all got vulnerabilities. So for me, leading by example and being able to show that vulnerability and accepting it's okay to have that and accepting that as part of the workplace and as part of how we operate is really, really important. And I think it can really help from a number of perspectives, whether it be internally, externally. It really gives us that chance to show colleagues that you know it's okay to be human, it's okay to have frailty, it's okay to have rough days, and we'll be there and we'll understand that and we'll help you through that.
I think one of the key things for me about leadership and why it's crucial is that we need to care enough to be curious. And when we care enough to be curious, that then leads us to be courageous to make changes. And we all hold a piece of the jigsaw. And when you see and feel your leaders, wherever they sit within the system and the process that you're in, if you see that and feel that, then you're able to then feel safe enough to make changes. And I think it's about being a very visible leader and using our voice to be able to recognise where things are working well, recognise where we can implement changes, and actively listen to the voices of what those people who are the people that are accessing our services are saying to us, and being able to listen to that and to feedback and to make changes that are within our gift to make. And I think the most important thing as well about leadership is leaders come in all shapes and sizes, and sometimes we walk behind people so that we're supporting them. Sometimes we walk in front so that they are seeing the role modelling and the behaviours that we're able to exhibit. And then crucially, we walk side by side to make the changes that we need to do.